This video is to introduce a peripheral nerve block for post-op pain control in posterior cervical spine surgery called cervical cervicis plan block or CCeP block. Posterior cervical spine surgery often involves a deep midline incision, mobilization of paraspinal muscles, and resection of bone, which can cause significant post-surgical pain. Bilateral ultrasound guide cervical cervicis plan CCeP block. It targets the dorsal rami of cervical spinal nerves. It has been performed for post-op pain control in posterior cervical spine surgery. CCeP block has been called several other names, such as intersemispinal plan block. This is the anatomy of posterior cervical region. On the left side, you can see the semispinalis capitis muscle. On the right side is the cervical cervicis plan, which is anterior to the semispinalis capitis muscle. This is a continuous plan that extends from the occiput to the C7 level. The dorsal rami of the cervical spinal nerves run through that plan and provide branches that innervate the posterior cervical muscles and the skin. The deep cervical vein and artery are in this fascial plan as well. The nomenclature is critically essential for teaching, research, and the clinical practice of regional anesthesia. For that purpose, we would call the fascial plan lateral to the multifidus muscle as a cervical multifidus plan, CMP. The fascial plan lateral to the cervicis muscle as a cervical cervicis plan, CCeP. And the fascial plan lateral to the capitis muscle as a cervical capitis plan, CCAP. The first part of this video shows ultrasound guide cervical cervicis plan block at C5 level to cover the surgery from C3 to T1 level. The patient was kept in prone position under general anesthesia. A 2-inch echo block needle was placed at the level of C5 spinous process between the cervical semispinalis cervicis and the cervical semispinalis capitis muscle. 0.25% or 0.5% of Bupivacaine 10 cc was injected bilaterally. The needle from lateral to medial approach. In general, the CCeP is a bright fascial layer under ultrasound, which is easy to be identified. You can identify the deep cervical artery on the left corner. The second part of this video shows ultrasound guide cervical cervicis plan block at C2 or C3 level, which can be used in the surgery from C1 to C4 level, such as Chiari decompression procedure. This video demonstrates the ultrasound probe was scanning from C3 to C2 level. In this video, you can see the local injection at the C2 level. As for intra-op neuromonitoring, I have done many of CCeP block since 2016. I have never seen any CCeP block that impact SSEP and MEP signals during intra-op neuromonitoring. Thank you for watching this video.